Hello everyone, this is Dr. Gobind Rai Garg. Next question. Here a 45-year-old man present with flank pain and there is a renal calculus. So it is a kidney stone. He was started on thiazide. Question is, what is likely mechanism by which thiazide can cause this adverse effect? So what you need to understand that thiazides, they are normally used to treat, or we can say prevent renal stone, right? What is they used to prevent renal stones? That is the main action of thiazides. The question is how they prevent renal stone. They basically increase the reabsorption of calcium from the kidney. So when more calcium is reabsorbed, less will be in the urine. So when less calcium in the kidney, so less stone formation. So that means decreased excretion of calcium is the primary mechanism. Remember we discussed loop loses calcium, thiazide retain calcium. So less calcium in the kidney, less stone formation. So that is the primary action of thiazide. But there is another concept that in the urine normally citrate is present. Citrate. And this normally bind to calcium. So when citrate bind to calcium, the complex will be excreted out. So basically citrate in the urine is preventing the formation of stones. Now thiazides, they can result in hypokalemia. Hypokalemia can result in intracellular acidosis. And when there is intracellular acidosis, there is more citrate reabsorption. That means citrate will be excreted in kidney. Citrate will be excreted less in the kidney. So when citrate is less in the urine, it will not be able to bind to calcium, and that calcium can cause stones. So any drug which cause hypocitraturia can cause stones, because citrate is not able to bind to calcium, so calcium will be free to cause stones. Okay? Now that's why thiazides, whenever we are using to prevent renal stones, we are usually giving it with potassium citrate. When we give it with potassium citrate, number one, hypokalemia will not occur. Second, citrate we are giving itself so that more can be excreted in the urine and it can bind calcium. Clear? So examiner is asking this concept that citrate deficiency in the urine can cause stones. Clear? So the right answer here is decreased excretion of citrate. This is the hi-fi concept. Normally you should remember this only, that they prevent renal stones. Rarely they can cause renal stone. That is asked here. Okay.